Okay, so everyone please mute yourselves so there's no background noise. So hello everyone, good evening. My name is Dr. Monica Gilbert. I am coming to you guys from Crystal Minds New Beginning, and I have my colleague and one of our dearest BCBAs here, Jonathan, who will be accompanying me through this presentation. I'll let you introduce yourself, Jonathan.
Yes, of course. My name is Jonathan Plaza. I'm with Crystal Minds. I've been a behavior analyst with Crystal Minds for about 7 years now. I've been fortunate enough to be part of the team. Today I'm collaborating with Dr. Gilbert on this topic that has been of interest to a lot of people. So I'm looking forward to it.
Thank you. Jonathan, please call me Monica. It's so weird whenever you refer to me as Dr. Gilbert. I've known Jonathan before I was a doctor, so I was like, just call me Monica, please.
Monica.
But anyways, thank you guys for making it here. We're going to talk about ADHD and ABA. All right, so I'm muting some of these. Okay, all right, so we're going to talk about ADHD and ABA, and the topic is the alternative to medication. So we have some therapists here, we have some parents, we have, some pediatricians, I believe. So we have a lot of people from different disciplines. Thank you guys for making it. We'll try to be brief and answer all the questions you guys have. So first, what is the reason why we wanted to come up with this webinar? Well, the reason why I wanted to come up with this webinar, and I asked Jonathan to collaborate too, is because we know that in the treatment of a lot of the times, sorry guys, can you please mute yourselves when you come in? All right, so as I was saying, a lot of the times when we hear about ADHD, right, the automatic thought is medication, right? Medication adherence. And really treatment or ABA therapy is not really recommended, most of the time, right? So some pediatricians don't really tell parents to get ABA treatment or other types of mental health treatment, right? And actually the research shows that in order to get the best prognosis, a combination of medication and ABA and behavior treatment is really the best for the best outcome. So that is the reason why I wanted to bring this along. And when we say the alternative to medication, the alternative, if you look it up, what it means is one or two of available possibilities. So if we have an alternative plan or method is one that you can use if you do not want to use the other, right? So some parents are skeptical about using medication, or sometimes kiddos are under 5 and they just can't use medication, right? So it's important that people know that there are therapies out there that are empirically based and that can help with some of the symptoms of ADHD. Will it help with every single symptom? Obviously not, but it will help with some of the symptoms that can be very impairing. All right, so let's get started. Jonathan, do you want to say anything else before I get started?
No, I think you covered it. You covered everything. I think one thing that's worth mentioning before we move on is, for the children that are not under medication for ADHD, they typically have a learning history based on their interaction with the world, and I think they at times are accustomed to obtaining desirable outcomes through inappropriate behaviors, right? So I think, as we go down the slides, I think we'll be able to cover how ABA can play a role in almost reversing that and creating and teaching more appropriate alternatives, right?
Absolutely. And again, we're not saying that medication should not be used. We are just saying that if you're a parent that is against medication, it's completely up to you at the end. So, this is something that can help, right? But the research is clear, but we will share our side of it, which is the side of ABA. So let's go over the facts of ADHD. Okay, so I'm just going to go over some brief facts. So the first thing is that there's really no such thing as ADD anymore, right? So you may hear your pediatrician, your psychologist say that, but ADD is out, right? So the name that is used now to describe what used to be ADD is ADHD, attention deficit hyperactivity disorder. The second fact is that I hear a lot of people, and I'm sure, Jonathan, that you've heard people say this as well, right? Like, oh my gosh, I probably have ADHD because I forgot this important thing, or I lost this, right? I don't know if you've heard people talk
Yes,
about
absolutely.
ADHD like that.
Absolutely.
And the truth is that not everyone meets the criteria for ADHD. And Jonathan and I were actually, speaking about that, right? That a lot of people think that it's overdiagnosed, and sometimes it is. You really have to go to the right clinician in order to get the diagnosis. And always look for a clinician that specializes in whatever it is that you are trying to treat, right? But in order for someone to get a diagnosis of ADHD, according to the DSM-5, which is the manual that psychologists use, you need 6 symptoms. So you have to meet 6 symptoms, and it has to be persistent for about 6 months already, right? So it's not that you forget one day and then a year after you forget again, right? It has to be something that's persistent and is really getting in the way of the child's academic progress, in the way of them making friends. It's just getting in the way of them interacting with others as well. And the symptoms have to be present before 12 years old, right? So you really don't develop ADHD later on in life. They have to be present before 12. Now, there are situations where you can develop symptoms of ADHD if you have like a traumatic brain injury, if there's a substance use abuse, if there's a medical disorder, right? So all those things may contribute to developing symptoms that look like ADHD, but it wouldn't really be ADHD. All right. So the third fact is that there's actually 3 types of ADHD. Jonathan, do you know what those 3 types are?
Inattention, hyperactivity, and
Combined. People always forget the combined one, right? But so yeah, so it's the inattention one, it's the hyperactive, and it's the combined. So let's go over the inattention. So ADHD inattentive type. So these are the individuals or the kiddos that avoid engaging in tasks that require sustained mental effort, right? So a lot of us don't like doing things that we don't like, right? Like who likes focusing on things you don't like? But it goes even further, because it gets to a point that even though they're motivated and they want to do well in school and get a good grade, it's just difficult for them to actually engage in those tasks, right? To the point where they can be failing their grades. The second one is that it fails to give close attention to details or make careless mistakes. So oftentimes they may write, right, all over the place. They may forget, to put the dot in the I. And of course, we have to think about it developmentally. If they're starting to write, that is totally typical. But these are things that tend to happen, right? They fail to pay attention, like close attention to the details of things. Does not follow through on instructions and fails to finish tasks. Difficulty sustaining attention in conversations or reading, right? So oftentimes this can get in the way of them socializing with others. Imagine someone speaking with someone else, and then this person's just like going on tangents, right? That person may think that the other person is a little rude when it's just difficult for them to sustain attention in one conversation. Does not seem to listen when spoken to directly. So a lot of the times teachers, instructors may think that this child is just non-compliant, is a rebel, right? And reality is just that it's difficult for them to actually pay attention and listen and process while the person is saying something. Difficulty organizing tasks and activities. They usually lose things. The room's a mess. Everything's all over the place. Shoes are everywhere. Distracted by extraneous stimuli. So I remember a client that told me this, right? She said, my brain on ADHD, which people don't understand, is pretend that you're going to present right in front of everyone. And then all of a sudden, the light starts flickering, there's sounds everywhere, people start like, eating candy bars and, scratching the table. And she told me that's what happens with me, right? I'm trying to focus on the presentation and all of these different stimulations are coming in, and it's just really hard to focus. So that's sort of like what it feels like. And then forgetful in daily activities, right? So forgetful where you left your keys, they're in the fridge one day, the other day, who knows where else they may be. Happens, right? All the time. But remember, you need 6 of these in order to meet criteria. So this may happen to us, like, one of these or 2 of these symptoms. But if it happens for 6 months and it's 6 of them and you had them before you were 12, then you may have you may have this diagnosis. Okay, so something really weird happened. So what do you think about this, Jonathan? Have you met or worked with families, kiddos that may be experiencing this?
Yeah, absolutely. I think one of the biggest things that in my experience, that I've come across is difficulty with attention span, right? And the limited attention span a lot of times can create a situation where those symptoms occur, right? Where difficulty following tasks, um, or staying on task, being able to just sustain attention and even eye contact at times during conversation, right? So I think in my experience, what I've experienced is that I've come across a lot of cases that have difficulty with attention span, and through the use of ABA, which we'll cover later, we can create behavioral plans that promote just that promote more appropriate behavior when it comes to attention span and being able to engage with a communicative partner, for sure.
Definitely. So I always tell I always tell people that there are certain sort of like organic or neurological things that we cannot quote unquote change, right?
What are you doing? Go over there.
Okay, guys, please mute yourselves when you come in, just there's no background noise. So there's certain things like processing speed, right? Like it's not processing speed, doesn't matter how much ABA you do, you're still, your processing speed is what you're born with. Just like your IQ, right, is what you're born with. So definitely. Okay, so we have a question here. How early is this diagnosed? So as early as people see the symptoms, right? Like I personally, I'm a psychologist as well. So I don't like diagnosing until they are in at least kindergarten, right? In the school years, because that's when we're really able to see the symptoms. And there are different ways of diagnosing. I like using objective assessments to actually diagnose. So there's like computerized tests that measure how impulsive the child is, how inattentive they are, which are very good. So I tend to use, some of these tests to diagnose. I don't just like observe and say, oh, you meet criteria, or base it on what the parent is saying, right? Okay, so the second type of ADHD is hyperactive or impulsive type, right? And when we think about ADHD, this is what we think about. So when we think about ADHD, this is a child that blurts out answers before a question has been completed. They leave the seat in situations when remaining seated is expected, run about or climb in situations where it's not appropriate. Again, developmentally appropriate, right? If it's 2-year-old, 3-year-olds, it's fine. But a 9-year-old, you wouldn't expect them to be jumping and climbing all over the furniture. Fidgets with or taps hands or feet, or squirms in seat, unable to play or engage in leisure activities quietly, right? So we can see here how this can disrupt a lot of this socialization with others. Always on the go or acting as if driven by a motor, right? So this child seems like he cannot stop. He's all over the place, always running. So definitely teachers get very frustrated with this type of child. Hyperverbal, so they're always speaking, right? Like very quickly, just like I'm doing right now. Difficulty waiting his or her turn for different situations, and then interrupt or intrude on others, right? So sometimes they may seem like they are a little rude, right? Because they're intruding or interrupting on others, but oftentimes they just don't realize that they're doing so, right? Because they're just like on a quick mode. So have you seen children or adolescents or people you've worked with, Jonathan, that may have this ADHD, hyperactive and impulsive type?
Yeah, absolutely, absolutely. I think one of the main things is in terms of turn taking and being able to wait out of turn. That's a difficult task for a child that's diagnosed with ADHD. So I've seen that a lot, just difficulty waiting out of turn. When you talk about just classroom instruction and just being able to function in the classroom with your peers, being on your staying on task and being able to be in your seat, that's something that there's a lot of difficulty there. And in my experience, we've tried to create situations where we can make sitting and staying in your chair and being an active member of your classroom more desirable by creating and manipulating motivational variables, right, to reinforce that behavior. So I have definitely have experience with that, with hyperactivity. And as we'll cover now in the next couple of slides, we'll talk about how ABA can play a role with that.
Right. And I feel like the inattention type, these kiddos get like overlooked, right? So people like kiddos who have ADHD and inattentive type, I mean, they may say, well, he has trouble focusing, but the ones that like really call out the attention are the hyperactive, right? Because they're doing more of these, hyperactive things. So a lot of the times we'll see more of these kiddos go to therapy instead of the inattentive type, right? For obvious reasons. But it's important to know that, both exist, right? And some people tell me, like, or they ask me, is ADHD one of these novel things? And I'm like, no way, it's been there forever, right? Like it's been there, it just hasn't been diagnosed, right? A lot of people have been able to do the things that they have to do, but they've done them with a lot of anxiety, right? Just because you do them doesn't mean that you did them like simply. And another question that I also get, Jonathan, I don't know if you get this question or you see this a lot, when we're working with Hispanic families is, well, in my country, no one had ADHD, everyone passed school and everything. And what I always tell people, because I went to Cuba, I lived in Cuba for 2 years when I was an adolescent. I wasn't that good, so they sent me there. But so, the school is different, right? It's not so squared. It's not so, it's not the way that the schools are here, right? So you have like more flexibility, right? So you're not able to see how the ADHD gets in the way of your academics because it's not as strict as the schools here. So that's why perhaps we do see some of these kiddos get diagnosed more often here. What's your take on it, Jonathan?
Oh, absolutely. And I think I coming from Colombia, I see that as well a lot. And
Right.
when I talk to family members and everyone that and I discuss kind of like what I do and the individuals that I work with, a lot of times it's like, oh, aquí no hay de eso, aquí no hay de eso, and it's like, but a lot of times, it's also, they don't have the tools also to properly diagnose
Right.
individuals, right? So and get the proper resources. So that's a big thing too.
Exactly, definitely. All right. So another fact is that the prevalence, and again, this is according to the DSM-5 TR, our new diagnostical manual. The prevalence is 7.5 of children are diagnosed with ADHD and 2.5% of adults. I always think that this is really low, but remember, this is based on clinical studies, right? So this is based on people that actually go to therapy. People that don't go to therapy are not going to be a percentage here, but we know that they exist. Fact number 5 is that there's high indication of heritability, right? Whenever someone has ADHD, perhaps a parent, perhaps a grandparent, someone down the line has ADHD, but there is that high heritability. Again, remember that back then things weren't diagnosed as such, right? We see more diagnoses now. I think that in the future, like our kids, right, when they ask them, oh, did your parents have like mental health disorder? Like they're going to know exactly, right?
Right.
Because we're more open to it now than before. Before we're like, well, I think they had like depression, they had ADHD, but we never, no one got treated. So we don't know. And then fact number 6 is family interactions in early childhood are unlikely to cause ADHD, but may influence its course or contribute to secondary development of conduct problems. And that is why we're going to speak about we're going to speak about ABA, right? But I hear this a lot, and I don't know if you do, Jonathan, but some of my families that I work with, they tell me in Spanish, they're like, oh, but this child is just malcriado, right? He behaves bad. This is not ADHD, right? Like he'll just grow out of it. I don't know if you hear the same.
Yeah, absolutely, absolutely. And I see that a lot as well. And what's ironic about that is, as a behavior analyst, when you see how they go about their behaviors, it's a lot of times they're, the behaviors that the child is engaging in, it results in undesirable outcomes, and the parents are almost reinforcing that behavior, right? So as a behavior analyst, it's hard to see. It's like no, but yeah,
Right.
I definitely get that a lot for sure.
Yeah. But it's not, like you as a parent did not prompt your child to have ADHD, right? Like
Right.
you may be reinforcing some behaviors that we can tweak around. But if they were born with ADHD, because ADHD is a neurodevelopmental disorder, which means that they were born with it. So if that's the case, it really wasn't anything that you prompted or that you kind of, incited. So I have a question here. So Annalise, we will get there. I promise. She's asking me any tips for children with ADHD. So we will definitely get there. Obviously, we cannot give you direct tips. We really, really want to, but we can't because it's not ethical and every child is different. But we'll give you guys like some things that you can take home with. All right. So fact number 7, or things to know about ADHD, are adults with ADHD, right? So these kiddos grow up to be adolescents who then become adults. So some adults, not every adult with ADHD, but some adults with ADHD may experience or may have difficulties keeping a steady job. They tend to have more motor accidents, propensity to be incarcerated, abuse substances, right, as self-medication, poor relationship with peers and families. And it makes sense, right? Like when you're looking at the symptoms, if these symptoms are not treated properly, we can totally see how this can end up here, right? Again, this is not every adult or every child, but you know, these are some circumstances where it may happen. What do you think, Jonathan?
Yeah, no, absolutely. When you look at the symptoms, just I'm just reading off the second bullet. It says have more motor accidents. You have, and the example you gave of getting ready to do a presentation and you have so much going on.
Yeah.
You know, perhaps being in a car and you're thinking about the presentation that you have looking forward, things that you have to pay, bills that you have to pay. I can see that. I can see that for sure. And it's not surprising that a lot of those with ADHD can suffer from these type of situations, right?
Right. There's a lot of also dropouts, right? That can, not everyone who's incarcerated was a dropout, but it can, it can go into that. But some children, I was talking to Jonathan, off the screen about this, but some children may think that they're just not smart. Like, why even try if I'm just doing very poorly in my class, right? And if they haven't had the right diagnosis, they haven't had the right help, they may really think that they just can't do it, right? And in reality, it's not that they can't, it's just that their brain is wired differently, which is fine. We just have to learn how to channel it. But for example, I had an individual that I worked with years ago, and we did a psychoeducation evaluation because he was failing all his classes. And he was just like, oh, I think I'm dumb. I think, I feel so bad because he was like, all this self-talk. And we did a diagnosis and we did a psychoeducation evaluation, and his IQ was actually high. It was high average. It's just that he had very severe ADHD, right? So we needed to get that under control so he could shine and show the world what he was all about. And we're able to do that, right? But this is some circumstances where some teachers, some parents, they may just feel like the child may not have, may not be smart enough, or something else is going on. And it's just really untreated ADHD. So there is sometimes a lot of dropouts because of that. I like to talk about the other side of ADHD, right? Because we always talk about these diagnoses, and me as a clinician, I'm always diagnosing and looking at the criteria and the symptoms and all that. But I always think that there's always another side to things, right? And it's all about channeling. So this is the other side of ADHD. So hyperfocus and being can also mean being extremely productive. And when they are really passionate about something, this is something that people with ADHD can do, right? So it's really all about channeling that hyper focus, right? That dopamine producing agent to other things that are going to help them towards the end. They're very creative. They have a huge imagination, very flexible in their thinking structures, right? So a lot of people with ADHD may become artists, may do things that tend to be more creative, right? They're able to think outside the box and look at things more colorful and a little bit differently. They're impulsive, so it means quick reaction. They're always on their toes on emergency situations. I was just telling Jonathan, imagine someone who's a perfectionist and works in the emergency room. Who would like someone who's a perfectionist in the emergency room? No one. Like you want someone who's going to think quickly and say, let's go, with the proper training, of course. They're humorous, full of energy. They're spontaneous, willing to take risks. So entrepreneurs, for example, a lot of them have ADHD. They're able to take these risks and make these calls last minute. They're able to multitask, and they're highly organized and punctual. What do you think, Jonathan? Are we highly?
No, I've had situations where I've worked with individuals that are, I guess, on the other side of the ADHD, and you see their ability to multitask. And
Yeah.
in one particular case, I have one kiddo that that he's a content creator, and his creativity is off the charts, right? So although he has difficulty with some behaviors and other symptoms that create situations and difficulty in the classroom, we've been able to identify his strengths, right, and really build on that. So
That's awesome. Yeah. Yeah, exactly. It's just channeling it. So that last part, I just wanted to make sure you guys are still with us. It says they're highly organized and punctual, and then I put gotcha, right? So they aren't highly organized or punctual, but that's okay. We each have our strengths, and we each have our different things. So we're going to go into the ABA side now, and then we're going to combine all this stuff together. And I want to leave a lot of the time left over for you guys to ask your questions. If you have any questions, please put it in the chat. I'm looking at it and I'm responding to them as we go. And I have some questions as well of some people that have messaged me on Instagram. So I'll answer those if you guys don't have other questions. But at this time, does anyone have any specific questions about ADHD before we move on to the second part?
Would you say that the treatments you're going to recommend are for children specifically, or would they work for adults also?
So the treatments, we're going to talk a little bit about how ABA can treat some of the symptoms, right? And some of the things that we've used based on our experience, right? But again, these things are, they're very general, right? So they're not individualized. But yes, it can work for adults as well, right? Like self-management techniques and things like that, or things that adults can definitely use, and they can use it themselves, right? Like, that's what self-management is, something that you're going to use on yourself, if that makes sense. Okay, I have a question here.
Thank you.
Not a problem. Hi, a teacher can diagnose? No. So good question. Who can diagnose ADHD? So teachers cannot diagnose. So the people that really have the ability to diagnose are psychologists, LMHCs, LCSWs. So anyone who's really licensed to diagnose, neurologists, medical doctors diagnose. And I don't know if there's any medical doctors here, guys. I'm not hating, but they diagnose, but sometimes, I really think that you have to be competent in that area to give the diagnosis, right? But they are able to diagnose, and they actually give out prescription medications as well. So yes. So now ADD falls under ADHD and attentive type. What if the client was diagnosed with some years ago? Yes, so that's a good reflection. So ADD is ADHD and attentive type. That's basically what it is. If they were diagnosed years ago with ADD, if they get re-diagnosed, hopefully they give them, the ADHD and attentive type, because that's what people look at now, right? If they see ADD, they're gonna know it's like, an old diagnosis. Any other questions? Okay, you guys can still type them here, and I'll be looking and answering them as we go. All right, Jonathan. So let's talk about ABA.
Talk about how ABA. So how can ABA help treat behaviors related to ADHD? So first, we can start by, I'm going to read this quote first. Applied behavior analysis is the process of systematically applying interventions based upon the principles of learning theory to improve socially significant behaviors to a meaningful degree. It's a lot. There's a lot there. What does this basically mean? ABA is a scientific approach for identifying variables that influence behavior, and us as behavior analysts, we use this information to generate behavioral change plans that produce more appropriate alternatives, right? And socially significant behaviors that are more appropriate. And I think that's how ABA can really play a role with ADHD and really modifying behaviors that perhaps in the past have obtained desirable outcome, but maybe in inappropriate ways. So how do we obtain all this information? Well, several ways. Let's start with the ABCs of behavior, also known as the three-term contingency. And the three-term contingency basically consists of the antecedent stimulus, behavior, and consequence. In this particular example, we have this little man, let's say his name is Johnny, and Johnny's presented with a non-preferred food, his veggies, and the presentation of this food would be considered an antecedent stimulus. Now, the antecedent can trigger or set the scenario for behavior. In this particular example, we're presenting Johnny with the food, and his behavior is to scream. And so he starts engaging in screaming behavior, and the consequence is really what's going to determine whether the behavior, the screaming behavior, is likely to, to happen again in the future, or if the likelihood of it happening decreases, right? So it all depends on whether the consequence is reinforcing to the child or whether it's punishing. In this particular example, and we'll talk about the functions later on, but in this particular example, if Johnny, if Johnny's screaming resulted in the food being removed, then it's likely that that consequence was reinforcing to him, and which the outcome would be that it'll increase the likelihood of him screaming as an option to avoid that food, right? So I think the three-term contingency is where we get a lot of our information from. And why do we behave the way we behave? A lot of us behave, the behaviors that we engage in is either to ask to obtain attention or get attention, or to delay or evade something, avoid something that is non-preferred, right? And in ABA, we have subcategories which consist of four major functions. And we have an acronym here to kind of help us remember the functions of behavior. But we have tangible, which is basically anything that holds value to the individual. It could be an object, it could be an activity, right? And usually one of the functions of behavior could be to get access to these preferred activities or items, right? That may be a motivating factor in our behavior. Escape, as mentioned before, is also one of the functions, which is basically us trying to avoid something that's non-preferred. Sensory, which is basically just has a component of feeling good, right? So we engage in a certain behavior because it feels good to us. And attention, as we mentioned on the previous slide, it's basically us wanting to obtain attention, right? So our behavior, we're engaging in it to obtain attention. So having that information allows us to really be able to develop a very individualized plan that accounts for the function of behavior, and that can help us create a plan that can teach appropriate alternative ways of obtaining these outcomes in a more appropriate way. Right?
Right. And then just to follow up, so as Jonathan mentioned, I'm sure that if you all reflect on all the behaviors you engaged in since you woke up this morning, right? Everything that you actively engaged in was either to obtain something or get away from something, right? Like all of them are in those categories. So when we talk about obtain, just like Jonathan was saying, you're either getting attention, you're getting something you like, a kiss, a hug, whatever it is, right? And then when we're evading or getting away, we're trying to get away from something we don't like, right? Something as simple as the alarm clock goes on, right? And what do? You start like tapping it, or on your phone, you start like, snoozing it. So all those behaviors are to get away of that, of either waking up or get away of, not have to listen to that noise, right? And then in behavior analysis, that's what we do. So we analyze a function. We try to see what is the reason, right? Let's get to the core of it. Why is a child engaging in this behavior, right? And we see a lot of like these sensory maintained behaviors with ADHD, just like we see them in autism as well, right? We do see them, right? So that is the way that we can kind of collect that data and say, okay, if we know the function, we know why they're doing it, now we can find a more appropriate way that they can still get what they want, whether that's that sensory stimulation, that attention, whatever it is, but in a more appropriate way, right? That's going to help them. And when I say appropriate way, I don't mean it so much for like social and people, right? But for them as well, right? For them to be able to obtain the things they want, to make the friendships that they want, right? To get that job they want in the future. So all of these things that are important to them. So Jonathan, I think something important to mention too is for some of the listeners that may not know about extinction and things like that. Can you explain a little bit about extinction and how that works?
Yeah, basically, we have, and this goes back to an example that I gave earlier on our history with our interaction with the world, right? And we have learned behaviors, and a lot of times we have a history of reinforcement there where perhaps inappropriate behavior has resulted in desirable outcomes, right? Because it's been reinforced. And the whole idea behind extinction is basically to identify that reinforcement and try to withhold it, so that that inappropriate behavior is no longer obtaining that reinforcement, right? And we do that in efforts to decrease the inappropriate behavior.
Okay, perfect. Yes. And so which symptoms of ADHD, and remember that you guys can put your questions here on the chat. And if you want to send it privately to me too, you can, and then I'll read them off. But kind of like combining what Jonathan, the information that Jonathan gave us, and this was like a very brief, window into what ABA is. But I wanted to kind of combine the symptoms of ADHD that we went over and some of the treatments or some of the things that we can do with ABA. Okay, Jonathan, so I'll need your help for this so we can do it together. But let's look at the first symptom of ADHD, inattention, right? So again, this is a child who doesn't pay attention, who has trouble focusing, right? Who loses things. So the first one is avoids engaging in tasks that require sustained mental effort, right? And I put a reading because usually it's reading, but it can really be other things. So what are some things, some techniques, Jonathan, that you've used with your kiddos in the past?
Well, in the past, in situations similar to that, I could, depending on obviously the functioning level of the child, perhaps a contingency contracting, making engaging in non-preferred tasks and tasks that require mental effort, making them setting that as a criteria in order for them to be able to access reinforcing activities, right? So in our science, we identify that as like pre-MAC principle, but for those that are not familiar with ABA, so it's like, okay, first we engage in this behavior, and if you show that you're reading and you're participating in this non-preferred activity, then you're going to have access to the things that you enjoy and the things that are reinforcing to you.
Yeah, and I actually was reading a couple weeks ago. I was reading something that I found very interesting. Well, I wasn't reading because I usually don't read, but I was listening to something that I found super interesting, and it was someone was there was this psychologist that was talking about the dopamine, the dopamine and neural and any that we see, the lack of it in children and individuals that have ADHD, right? So usually these are like the excitatory kind of neurotransmitters. So they don't have as much. So when they do find something that they highly enjoy, that's when they start getting, a lot of these neurotransmitters like firing up. So when we pair it with when we pair something that is not preferred with something that's preferred, we may somehow, kind of pair that together. So then they can also, experience these good feelings by completing these things, even if they're not things that they highly enjoy. So I thought that was really interesting, which kind of plays a role in this. So the second one is fails to give close attention to details or makes careless mistakes.
Fails to give close attention to details or makes careless mistakes. I think, for in this situation, it may be a task that it could be difficult. So a task analysis and breaking a difficult task into smaller teachable units, I think would be a good way to increase the likelihood of success for the child, right?
Yes, yeah, exactly. And also like sometimes self-management skills, right? So we've been talking about self-management skills. Again, these are techniques that children can use themselves, right? So I remember one kiddo that I worked with, I used to tell him, he was like, it's so hard to focus. And I said, okay, why don't you try this, right? Every time that you're focusing on something and it's really important, you have to get it done, tell yourself, focus, focus, focus 3 times. And he said that he started using it and it actually helped him, right? Again, every child is different, but that may be a way to like redirect oneself, right? Like if you're leaving and you're going to an extraneous stimulus, right? Like refocus, look at it, right? So teaching the child how to do that so they don't necessarily have to rely on someone else to constantly do that for them. Does not follow through on instructions and fails to finish tasks. So again, as Jonathan said, using some type of like token system, some type of like contingency contract. So contingency contract is basically just a contract where, the parent or the teacher and the child agree to certain things. And then at the end, the child, obtains something that they really like, basically. So that's sort of like what a contingency contract is. Anything you want to add to that, Jonathan?
No. Basically, yeah. I think a first then contingency, and obviously using a visual such as like a token board would be ideal, just to motivate the child to follow through with the instructions for sure.
Right. The other one is difficulty sustaining attention in conversations and does not seem to listen when spoken to directly. So one thing that I've encountered that helps, at least with children with ADHD, is trying to get their focus, trying to get their eye contact attention. Not because you want them to stare at you, but because if they are looking at you, right, they're less likely to be looking at other places, right? It's impossible to be looking at you at other places at the same time. So then they're able to kind of, focus a little bit more on what you're saying, which most of the time, seems to help a little bit. And then does not seem to listen when, difficulty sustaining attention in conversations or reading, kind of like helping them understand these social situations, right? Like, so you're going to talk, and then when you see that the other person is showing you the nonverbals that they're going to start a conversation, right? They open their mouth, they start doing this, whatever it is. Then pause and wait and let the other person start, right? So sharing as well. That can help, right? Like sharing it in conversational exchanges. Have you had any experience with that as well, Jonathan?
I have, and I think something worth mentioning is also, as a therapist or as a parent, identifying those moments when the child is sustaining attention, right, and they are engaging in appropriate behavior, and reinforce often, right, and a high magnitude, right, to just really create that association between appropriate behavior and it being a good thing, right? And I think it's important to identify those moments as well, and really reward and really reinforce those behaviors.
Right. And there are like social skills as well that can be used for children with ADHD, right? So it's for them to understand these social nuances that sometimes we don't because we're not paying attention to it. Difficulty organizing tasks. So again, Jonathan brought up this task analysis. Jonathan, can you explain a little bit what a task analysis is for people that may not fully understand what that is?
So basically, a task analysis, I like to use that when there's a complex activity or task, say for example, shoe tying, and then we may want to break that down into smaller teachable units. So maybe, let's say instead of me reinforcing the child for completing the entire task, I may provide reinforcement. Let's say, for example, if I have a token board or a token system in place, I may provide some rewards or some tokens for the initial step, which it may be to hold both shoelaces up high, right, and then the cross and under, right, and break every step down into smaller units, and then really start to shape that behavior as we move on, right? So as we start to see that the child starts to meet criteria in each step, then we increase criteria, and then until a point where he's completing the entire task, right? But when it's a task that is very difficult, then breaking it down into smallest possible units and teaching them in that way can be very helpful.
Yeah, and even like for example, if you're parents, right, and you're doing homework and sometimes just like looking, right, that visual stimuli, looking at all the homework may make someone feel overwhelmed, right? May make the kiddo feel overwhelmed. So what I would do is use a lot of choices, right? So do you want to do math first or do you want to do reading at the end? They're going to do both. But having them first choose and then secondly do it little by little and then breaks in between. Like when I'm testing, for example, children that have ADHD, I give them tons of breaks in between, right? So there's no disruptive behaviors. And so they're able to kind of distract themselves for a little bit and then go on to the task. So definitely giving breaks, having those task analysis and using reinforcers and motivations can definitely help.
And
So
I think
let's look at the hyperact. Yeah, go ahead.
I just
Sorry,
want
we spoke at the same time.
No, I think I just wanted to add that that's also the importance of being able to identify the antecedents, right? Knowing that if you're placing a task, that's usually when certain behaviors are taking place, and you being able to identify that and being able to set up breaks or scheduled breaks because they're going to be helpful for the child is important.
Yeah, and it's I know there's a lot of parents that want answers and you guys want techniques, you want to use them, right? But I think the first thing is to really look at your surroundings, right? Like really analyze, like take a day of just baseline, right? Like you don't have to write anything down, but really look at every step of the process, right? Like why is the child engaging in that behavior? What's presented to them? What's being taken away? What happens after they engage in that behavior, right? What are things in the environment that are going on that maybe you can, maneuver, turn around, so it's easier to manage. And then after, you can start, picking your interventions and saying, this is what I'm going to use here and there, right? But first, it's important to analyze, sit back, and really see what's going on in the child's environment. I think that's super important. I mean, that's what we do in behavior analysis all the time, right? So definitely super important, to do before anything else. So when we look at ADHD, hyperactive and impulsive type, let's look at blurts out answers before a question has been completed. So any interventions that you've used for that, Jonathan?
I would say possibly the use of like differential reinforcement. And differential reinforcement is basically, you're reinforcing appropriate behavior and you're withholding reinforcement for inappropriate behavior. It has an extinction component, like we mentioned earlier. So, blurting out answers, although it's impulsive in nature, the child is obtaining a response from the communicative partner, from the teacher, right? So being able to identify the function on why he's doing it, and also being able to have a differential reinforcement strategy in place where we can reinforce raising hand, for example, or any other behavior that's not blurting out, while at the same time withholding that attention, right, that he's receiving usually from blurting out answers.
Exactly. Yeah. I saw actually in a classroom that, everyone was there in the classroom and the teacher had asked a question. And, there was one child that was like, me, right? And he was like yelling. And the teacher's like, let me see who's raising their hands silently, right? So she definitely did that well. And then the child, of course, stopped screaming and was just like very politely. And then she picked on him, right? So it's really having, those right expectations, and using all those techniques. Another one may be like a DRL, right? You spoke about differential reinforcement. So low rates of behavior, like we want the child to, to speak his mind and speak loudly and forcefully so people can listen, but maybe in some situations it's not appropriate to speak that loud, right? So reinforcing for like lower volumes or lower rates of that behavior that's going on. Leave seats in situations when remaining seated is expected. Again, expectations, right? Letting them know, okay, you have to be seated for this amount of time. If they want to come out of the seat, maybe having them request it in appropriate ways, right? So it's not so much that we want children to be like super compliant and do everything that everyone tells them. Obviously, we don't, right? We want them to use appropriate ways of getting those things they want, right? So, obviously in the school, it's not appropriate to just say, hey, teacher, can I get up and walk, right? But in certain situations it is, right? So we want the child to use his communication or her communication more than anything else. What do you think, Jonathan?
No, yeah, and also, as a behavior analyst, as a therapist, or as a teacher, as a parent, just being able to visually cue the child so that they're able to know when they'll have access to engage in these behaviors. Maybe when he'll have access to for his next recess break. Just being able to be able to show them when they're going to have access to this can also help in almost holding back that behavior, right? Because they know they will have access to it eventually.
Right. There's one here that is fidgets with or taps hands or feet or squirms in seat. So that's more of like a sensory thing, right? Well, if it is sensory, of course, we have to look at the function. But the way that is put here is more of that sensory origin, right? So looking for replacements, right? Looking for appropriate ways where the child can still, I think they've started this whole thing of like fidget toys, right? So it's sort of like that that concept of finding appropriate things that they can use that won't disrupt other children, right? Like if you're grabbing something that's big and you're going like that, it's going to disrupt everyone around them. So just kind of showing them a way where they can do that and they're not really disrupting the other kids or whatever it is.
I think we have a question here, Monica.
Yes, we do. Okay, so doctor, is this hereditary? Both parents don't have ADHD. I don't understand how my child has ADHD. Is there explanation? So, it's not that there's like one target thing that you're, that which is why you're going to get why your child's going to get ADHD, right? Sometimes, there's just no explanation. It is highly hereditary, right? But it may be so that some parents don't have ADHD and then the child has ADHD. So yes, I think I answered your question. Okay, we have another question. I have a client who squirms and is very fidgety. So I give him therapy while he sits and it works really well. Okay, thank you so much. Yeah, for sharing that. So therapy, I don't really know what therapy is. I've never used that in my life.
It's almost like a Play-Doh, just like a lot
Okay.
more firm. It's almost like OT based, and they use it a
Oh.
lot for strengthening, their fingers and fine motor.
Thank you, Sarah. I learned something new today. This is during carpet time where they have to sit and listen to a story. It is too much sitting and waiting for him. Good, good. So they're able to use that, and they're able to, to sit down. They're able to sit down and focus on the story that's being read. Good. Thank you for sharing. Any other questions? So we're getting to really the end of our presentation, but any questions you guys have, please send them my way. You can also unmute yourselves if you feel comfortable doing so. And I can read some of the ones you guys have sent through my messages. Questions?
I did want to bring something up. I wanted to
Sure.
I wanted to mention, I know you mentioned processing speed, but for latency and inner response time, how can ABA play a factor there?
Yeah, I think that's really interesting because there is, so for example, as I mentioned, there are certain things that we really can't learn to do, right? They are organic within us, right? That's what they taught us when they taught us about IQ testing and all that, right? So processing speed is one of them. Processing speed is how quickly we process information. You either do that quickly or you do that slowly. Like there's no ABA, no learning that can help that. It's something organic within us. But what can ABA do? So what do you think, Jonathan? If we can't really change our processing speed, what can we do like behaviorally?
Yeah, I think behaviorally, based on the strategies that we've mentioned, we can set up behavioral change programs and plans that can reduce latency. Latency basically is, let's say, for example, if Johnny's given instruction to clean up, the latency time would be the time between the instruction was given and when Johnny began following instruction, right? So using behavioral analytic strategies, we can create situations where decreasing that time it takes for him to start following instruction can be rewarded or reinforced, right? And for inner response time, it just basically refers to the time it takes. For example, I'll use a different example, but let's say Johnny's also given classwork and needs to finish this classwork in the next 30 minutes. Is the time it takes for each behavior or for each, let's say, for example, each classwork to be completed. So we can also, using behavior analytic strategies, create a situation where we're looking to decrease the amount of time it takes for him to go from one classwork activity to the next one, right?
Right. So it's not so much that we are changing the processing speed, but we're changing behaviorally how quickly they're completing certain assignments, right? So that is something that we can definitely do. So I think we have a question here. You mentioned a psychoeducational before. How can this be helpful? Understanding the child's diagnosis. Okay, good question. So psychoeducational evaluations are done by psychologists, school psychologists as well. And basically what that, what we tend to do is that we would first do like an IQ test, right? So the IQ test is going to help you understand the child's like processing speed. It's going to help you understand, their IQ, their intellectual quotation, and just everything else, that has to do with Also achievement, so how they're doing in school. And then we do like extra tests for diagnostic purposes. So we'll do like an ADHD test. If we see symptoms of ASD, we would do a test for that as well. So we just do different tests to see, you know, where the child is struggling the most, right? Sometimes they have a lot of, you know, sometimes they have like comorbid stuff. So they get diagnosed with ADHD, but then they have like a reading disorder or something else, right? So that's why it's so important to kind of do a combination of those things. My son started ABA therapy a little over a month, and I feel like ever since the therapy's gotten a bit like more defined, I think it's because more rules and being enforced. Is this normal? So I'll let you answer, Jonathan.
I love that question. No, that's great. No, that may be a sign that it's being effective, right? So I think in one of the examples that I gave, as far as extinction, for example, if we start withholding reinforcement for something that the child had a long history of reinforcement with, for example, let's say the child is accustomed to receiving attention by screaming, or we've now identified the function, and now we've created a plan that is going to withhold attention for that screaming behavior. So in ABA, we may refer to it as an extinction burst, right? So the behavior may get a little more of increase in magnitude, just because the child may feel at the moment like, I may need to scream louder in order to get the attention that I normally get, right? But then with consistency, we'll see that the behavior may start to decrease. So this is absolutely normal.
Yes. And like Jonathan said, right, they may be going through an extinction burst. You know, it really depends how consistent everyone else is doing what they're, you know, is intervening. You know, but definitely you want to fill it out and discuss it with your ABA therapist, with your team. If you feel like he's becoming a little more defined than normal, right? Because again, if you're asking this, then perhaps, you know, perhaps understanding the process is necessary, and maybe they haven't shared that information with you, right? But yes, a lot of the times when we start ABA, we see a lot of these behaviors, you know, momentarily increase before they decrease.
Absolutely.
Other questions? Okay, I have a question here that says, can you do individual therapy and ABA at the same time? So yes, they're not mutually exclusive, right? You can do individual therapy and ABA at the same time. I think we should really collaborate. I feel like in Florida, it's the only state where professionals don't collaborate like everywhere else. But definitely there should be that collaboration, right? Like LMHCs should collaborate with ABA therapists, with speech therapists, neurologists. I mean, we should all be on the same page when we are treating, you know, the child.
I have an absolutely
Okay,
great question by Raymond. There's a great question there by Raymond.
How early in age can you do an IQ test? So I believe the earliest is, oh gosh, I think it's 3 years old. I have to go back. I haven't tested a little one in a while. I think it's 3, 2, 3. I think it's 2 actually. But you can test very early on. You know, there's different tests. So there's the WIMS, there's the WISC, the WACE, you know, so depending on the child's age, they can do tests, IQ tests. Also, there's nonverbal IQ tests that can be done. So even if the child is nonverbal, you can do these tests. Just keep in mind that a lot of the statistics are from, you know, typical children, right? So there's not a lot. It's not really a test for children that may have like, you know, severe ADHD or like sorry, not severe ADHD, it's like severe ASD. A lot of the times, you know, just it's not a good fit. So it really depends on the child. I personally wouldn't do an IQ for a child who's 2. I would wait a little longer. I've had calls of people asking for 18-month-olds, right, to get an IQ test, and I'm like, let's wait a little bit, right? Like allow them to develop a little bit. Plus, like, what will you do with that IQ test at 18 months? I'm not sure. So, but yes, they can. I think the youngest is like 2 years old, if I'm not mistaken. So any tips? Oh, where can they get an IQ test, and what exactly is it used for? So an IQ test, a licensed psychologist, you can also do it in schools. School psychologists can do those tests, and also licensed psychologists. We do them in our center in Crystal Mind Psychological Services. But you can also go to psychologytoday.com, which is a great place to look for psychologists and people that do testing.
There was one question here that it was a really good question by Raymond. Is there currently any research being conducted on the use of ABA techniques in treating ADHD? I know firsthand the power of ABA, but most insurance providers only consider an ASD diagnosis as medical necessity criteria.
There's tons of research out there. And if not there's tons of research on ABA, right? But also on like behavior, like I like to call it like the watered down ABA, but like behavior mod, or like, using some of the behavior techniques. So they may not call it ABA, but when we read the research, it's ABA. So yeah, there's tons of techniques out there. Tons of research out there. Why insurance companies don't cover? I think it's because they know it's going to be very costly. But I remember that insurance companies started covering ABA because a lot of families got together and started fighting for it, right? A lot of families went to Congress, they did all these things, and that's how they started covering it, right? So research is not enough. Having the research and just having it there passively is not enough, right? We have to do more disseminations. We have to do more of these webinars, to kind of get insurances to cover ABA, yeah, for diagnosis of ADHD and not only autism.
I think that answers also Sandra Escobar's question. Is ABA therapy covered by insurance when kids have an ADHD diagnosis?
Only if they have a comorbid autism diagnosis, right? So, and Down syndrome. So insurances will cover Down syndrome and ASD, but not ADHD, unfortunately. Any tips on how to reduce or what interventions to try to reduce humming or repetitive jargon if the client does not have a verbal repertoire yet and is unable to engage in functional communication? Do you want to take that, Jonathan?
Sure. To responsibly answer that, I think I would need to know more information, perhaps run a functional analysis. But yeah, in general, answering in a very general way, possibly teaching appropriate alternatives, perhaps a sensory alternative that can provide that same input. If it's dependent, considering, let's say that hypothetically I've already ran the functional analysis and I've identified that it's a sensory. The function is sensory. I may even schedule breaks where he can engage in this behavior, but only limited to that break, right? And then during the other times, we may be able to provide the sensory alternative, right? That we have in place. So, but I would definitely need more information in order to really, really be able to answer this question effectively. Yes,
good answer. Okay, let me see. What are the consequences of untreated ADHD? It depends what you mean by untreated, but it really varies from individual to individuals, right? I guess individuals, and it depends on so many other things, right? On the family dynamics, on, how much help this person has had in school, on their IQ, right? So it depends on a lot of these other factors that go into it. So it's really hard to answer that question. Obviously, treated ADHD is better than untreated ADHD, I think, but it really depends on a lot of different factors, right? It doesn't mean that if a child has ADHD and they've never received treatment that they're going to end up like incarcerated, right? Like that's not what it means at all. But obviously, if they are giving treatment, if they are giving accommodations in school, if they are given information too, because I really think that children, if they do meet the criteria for ADHD, they should know, then the course is different, right? And medication for those that want to give medication and of course need it as well. All right, so no other questions? Any final thoughts, Jonathan, you want to leave them with? Can you provide information about the side effects of guanfacine. I only gave it to my child for a month. I wish I could, but I didn't get at that point of my studies, so I really don't know what it is. I don't know, but I would recommend you ask your psychiatrist to see what the side effects are. And again, if you don't have a psychiatrist that you're happy with, find one that you are and that really specializes in these things, so they can, you can make sure they're giving you the right thing for what you're looking for. All right, guys, so this is the end of our webinar. Thank you everyone for being here, all the insightful questions, all your patience, everything else. Jonathan, do you want to, leave us off with some words?
I'll just thank everyone for joining us today. I think this is something that we need to do more webinars like this, just to be able to so that ABA can really start being like I guess like an option for not only ADHD but just in general. I think there's so many surrounding narratives around ABA, and I think webinars like this one are the ones that really kind of change the narrative, right? So we need more. We need more of this.
Yes, definitely. And I love the way you said it, options, right? Again, a lot of people don't know that ABA is an option for ADHD as well, right? So definitely, whatever you guys learned here, disseminate it, share it with everyone. And maybe, Jonathan, we should do this in Spanish. Some people have asked me if we can do this in Spanish. So we'll brush up on our Spanish and maybe we can do that. Thank you guys all. I see the messages. Thank you. Thank you. I'm glad you guys found value in it. And thank you, Jonathan.
Oh, thank you. Thank you, Monica. Dr. Gilbert.
Oh, gosh, just call me Monica. Bye, everyone. Have a good night.
Have a good night.
Bye. Bye. Thank you.